I think that we serve a population with patient care that's very diverse, and when we look at the statistics around diversity, we find that only 19% represent diversity. We find that only 11% of high and middle levels also represent diversity. So it's really important to match more of our population to those that we serve. But there's a bigger picture here, and that is that those populations have needs and great ideas and new innovative things that we've not necessarily thought about before because they come from a different place than the traditional CIO comes from. We've stuck with the traditional CIO because there's been a lot of change in our markets, a lot of change in what we're responsible for, and we feel comfortable. But what we found, if you get out of your comfort zone and you bring in new knowledge and new ideas, then your innovation and your ability to grow your organization and change what you do grows immensely. So it's a great opportunity for us. So as a healthcare CIO, I think that it is important that we're serving this population that we've been talking about. So if you think about how do you bring value to any company, to any job, to any industry, it's about looking at who you serve. It's just like with CHIME. You know, we pay a lot of attention to our members and what they need, how they think, what they're going to next. So take that analogy and apply it to the populations that we serve. They're very diverse, so we can take advantage of bringing those knowledge into our suites, our executive suites, and then going back out with products and approaches and communication that makes sense to the population we serve. It is an interesting thought to think where we'll be, and the conversation that we just had about whether or not our major vendors would disappear is a little alarming. It's very disruptive, there's no question about that, but I think what we should be thinking about is information moving almost seamlessly across the whole continuum of care. So what I mean is today our primary care environments are still very concrete. Much is found in brick and mortar, right? So what we want to think about is how do we begin to get information everywhere we need it and even get to the place where we're actually in a preventative sort of approach where we're no longer just providing information because of, you know, a catastrophic event has occurred, but instead we're providing information to help you live a better life and to have a better opportunity to have the best life you can, the best health you can have. So as information technologists, we know it's going to be critical that we have and will have safe, secure ways that are interoperable across. The other thing we've got is a mobile population that we're not dealing with well. So today we can very easily care for you in a specific setting or maybe even a specific town. But the minute that you begin to transverse the globe, we're in trouble and we need to get past it. I think in 5 years we'll be past it.